Greetings. I'm Kathleen Stein, the president of the League of Women Voters of St. Lawrence County and the convener of the League of Women Voters of New York State Rural Caucus. This presentation was originally created for the League of Women Voters New York State 2023 Biennial Convention. Child care shortfall in the hinterlands, the rural face of a national crisis. According to the Center for American Progress, about 1/2 of the U.S. population lives in a child care desert, which is defined as an area where less than 1/3 of parents are able to find available openings at a licensed child care provider. That figure goes up to 59% of residents in rural areas. This slide shows New York State's child care deserts. 64% of New York State residents live in a desert. And on this map, the darker the brown, the drier the desert. Childcare deserts are more common in lower income areas, whether they are rural, suburban, or urban, as you can see. Women, not surprisingly, are disproportionately impacted by the shortage of childcare because childcare is crucial to women's workforce participation. States with fewer childcare deserts have higher maternal workforce participation rates. The economic impact of the national childcare shortage is enormous. One study found that families forego $8.3 billion in wages per year due to lack of childcare. The U.S. Chamber of Commerce pegged the impact on businesses from absenteeism and turnover resulting from lack of childcare at $1.7 billion. In rural areas such as the North Country where I live, home-based family or group family providers are the rule. There are very few childcare centers in most of our region. Lately, many home-based family childcare providers have been leaving the area or leaving the profession. The pandemic greatly accelerated this long-term trend. My home county of St. Lawrence is a classic example of this situation. And I'd like to thank the St. Lawrence County Child Care Council Executive Director, Bruce Stewart, for sharing all these figures and later in the presentation too, all this information with me. As you can see, I was particularly stunned by the number of our school districts, 9 out of 17, that have 0 or only 1 licensed childcare provider in 2022. Also notice the percentage of our providers that are family or group family. And, you know, the alarming number of census tracts here in St. Lawrence County that are childcare deserts. This was 2019 figures. It's only gotten worse. Before we look at the main causes of childcare deserts, I'd like to mention the problem of the affordability of what childcare is available. Childcare in New York is the 6th most expensive in the nation, costing an average of $15,394 annually, or 22.1% of the median family income, according to the New York Department of Labor's 2023 Gender Equity Report. The U.S. Department of Health and Human Services recommends that families should have to spend no more than 7% of their income on childcare. Since 2017, however, in most of the U.S., childcare has been the single largest household expense. And as you can see from this slide, only in the West does housing outstrip childcare expenses. Again, St. Lawrence County, the infant care is the most expensive care, and the median yearly cost is $12,969, or 19.4% of median income. I call your attention, however, to women's median income in St. Lawrence County, and as you can see, infant care would be more than 50% of such a salary. As long as America lacks the publicly funded childcare system found in most other developed countries, adequate and accessible subsidies will be a necessary part of alleviating the childcare crisis. But to return to our main topic, it turns out that the main cause of childcare deserts is a shortage of staff, which is overwhelmingly due to inadequate wages for caregivers. More than half of childcare workers participate in a public assistance program because their wages are insufficient to meet their household expenses. And by the way, this is true of home care workers as well. It's not entirely unique to childcare workers. According to the Empire State Campaign for Childcare, ESCCC, and Schuyler Center for Analysis and Advocacy survey done in March of this year, 90% of New York childcare centers report being understaffed. And respondents to the survey reported that they were unable to compete with school districts, warehouses, retail, and food service jobs in terms of wages. And here you can see some of the numbers from the first 1,660 responses. The survey is, ongoing. You can see how many children cannot receive, how many children on wait lists, whatnot. So a living wage for childcare workers is critical, but there's yet another factor driving the childcare crisis in rural areas, a shortage of qualified people to fill childcare vacancies. Two innovative programs in Northern New York are working to recruit and train more childcare providers and to help them navigate the state licensing process, which is quite complex. The Jefferson Lewis Child Care Project started when the Lewis County Planning Department and their Economic Development Agency reached out to Jefferson County Community College. Soon, the Small Business Development Council of Jefferson County had joined the effort. 9 new state-registered providers completed the first round of training in 2022. The St. Lawrence County Family Child Care Training Program is a partnership between SUNY Canton's Early Childhood Studies Program, their Small Business Development Center, and the St. Lawrence County Child Care Council. The program, which is free of charge to participants, produced 7 new registered family providers in 2022. The only problem in St. Lawrence County so far is that most of the new openings for kids have been in our more densely populated communities. The real need is for more providers in the outlying towns and the smaller school districts. Other counties are copying these programs, including Warren, Essex, and Oswego. So more work needs to be done. Here's what you can do to help. 1, join your county child care council. Child care councils are independent county agencies funded through the Departments of Social Services and the New York State Office of Children and Family Services. Lately, there's also been quite a bit of federal money that has been available, and the councils usually administer that in the form of grants. As independent agencies, councils have boards of directors. See if your council's board needs additional members. If they do, volunteer to join. They can use your advocacy skills. I just recently discovered that the establishment of the St. Lawrence County Child Care Council was spearheaded by the League of Women Voters of St. Lawrence County over 30 years ago. 2, sign up for action alerts from the Empire State Campaign for Childcare and consider joining their newly formed Rural Caucus. The ESCCC's goal is to create a high-quality, free, equitable, and universal childcare system with a thriving wage for all childcare workers. 3, to address the shortage of childcare workers, work to promote training programs for childcare providers, such as the 2 that we mentioned earlier. 4, educate others. Organize a league event with your county child care council's executive director or a member of their board, a local early childhood educator, perhaps someone from a Head Start program, or BOCES or Cornell Cooperative Extension after school program. And perhaps you might want to also include someone from your economic development office or your Chamber of Commerce. Help your fellow citizens learn about the challenges facing childcare providers in your area and about the importance of early childhood education to future life and health outcomes, and also the economic development of your community. So go out there, do what you can, educate others, and there will also be available a sheet with other resources that you can check out online to become better informed. Thank you very much.